My name is Kimberly M, and I'm currently in PA school, so I love to study all of the time, love to practice my clinical skills, but when I'm not in the classroom, I'm walking my dog, hanging out with my friends, going to the beach, all the normal things a 25-year-old would do. I was in a skiing accident in 2016. That's kind of what I attribute all of my injury to. I'm originally from Greenville, but when I moved to Charleston, I started to have a lot more of these issues, pain, numbness, tingling in my left side of my leg with the lower back pain. I ended up in physical therapy with Patricia Bennett, and she was amazing. She was like an angel in my life. She helped me rehab back to the point of doing normal activities. And then I kind of re-injured myself just through sports and exercise again in 2022. And that kind of led me to Dr. Kalhon.
The leg pain is what brought her to the emergency room. So we saw her there, and she had a repeat MRI scan there showing that she actually had a worsening of her disc herniation at the L405 level. Her stenosis and her disc herniation was so big and her pain was so bad, and she had tried all these other things that really the only option left was to help her surgically. So what we offered her was a decompression, which involved removing some bone around the spinal canal, and then we bring a microscope or an exoscope into the field. We take a look at the thecal sac, we gently retract the nerve root over, and then you can see the disc herniation that's there. And then using micro instruments, you're able to pull out the herniated disc fragment. And we actually use an ultrasound at the end just to make sure that the disc fragment's completely gone. You have no concerns that there's any residual fragment. So that's a neat little trick to make sure that the patient's gonna do great.
I'm 10 weeks out from surgery now, and I have never felt better. It was like a miracle. I think I told Dr. Kalhon so many times, I was like, I've never cried in pain since my surgery. I've only cried tears of joy because it's been such like an amazing experience. Everybody's hand in my care had an integral and very specific and purposeful role, and I believe that everybody was put into my care team for a purpose, and I think that's why I've done so well and I've had such a great, successful experience.